Hello, my name is Lucy Beach and I'm a health and care law trainer, and I'm hoping to be part of Belinda Schwer's top team of trainers on the Care Bill starting in 2015. I've been working in health and social care commissioning and contracting for the last 21 years, and I have a wealth of skills, knowledge and experience in this sector. So I'm going to talk to you for about 10 to 15 minutes about the Care Bill. I'm going to go through a little bit of the background, but the main focus of this session is on the strategic duties and powers that it introduces. I'm going to be covering prevention, information and advice, market shaping, integration and cooperation, delegation of the social work functions and advocacy. So in terms of background, the Care Bill is a modern piece of legislation for the adult care and support in England. It replaces and updates complex and outdated legislation. It introduces a care and support system that is clearer, fairer and fit for the future. It focuses on people's well-being and supporting them to live independently for as long as possible. So in terms of the legal framework, it is comprised of three layers. Firstly, primary legislation, and that's the bill, and that introduces legal duties and powers. Secondary legislation, that's the regulations, and that will provide more detail on critical processes. And lastly, the statutory guidance, and that's the guidance on best practice in meeting legal obligations and delivering the care and support. So in terms of general responsibilities of local authorities to all people, well-being principle underpins the entire legal framework. It sets a defining purpose for care and support and influences the way all functions are carried out. There are universal obligation towards all local people, and that's a big change from before. It covers arranging services, facilities or taking other steps to prevent, reduce or delay needs for care and support. Secondly, information and advice to people to understand the care and support system, access services and plan for the future. And thirdly, promoting diversity and quality in the market of providers so that there are high quality services to meet people's choices. And there's a requirement to work collaboratively and cooperate with other public authorities, including the duty to promote integration with the NHS and other services, including housing. So to start with, looking at prevention, there is a duty for local authorities to provide or arrange services, facilities or resources, or take other steps that contribute towards preventing or delaying adults and carers' needs for support and reduce adults and or carers' needs in its area. Local authorities will need to identify services, facilities and resources already available in the area and the use to which they could be put to the prevention agenda. And they also need to identify adults and carers with needs for care and support which are not currently being met by the authority or others. So that's a big change with this new legislation. These preventative services can be charged for directly, so the council would be able to recoup the costs from commissioning these services. But local authorities will really need to consider how they are going to commission such preventative services and how the charging and financial assessments will actually be undertaken and the resources required to do that. The second area I'll focus on is information and advice. The bill introduces a duty to establish and maintain a service for providing people in its area with information and advice relating to care and support for adults and support for carers. This information and advice needs to be thought through in terms of what it will actually cover, but it will need to explain how the care and support system operates locally, the choice and types of care and support available, choice of providers available, how people can access the care and support, how to access independent financial advice, how to raise concerns about the safety or well-being of an adult who has needs for care and support, also to provide information about benefits and deferred payments, and it will also need to be in a format that is accessible to all people with care needs. So local authorities will really need to consider what and how to commission such information and advice services, and the scope and method of the information and advice that they will offer, and how it fits with any existing local provision and indeed any national channels such as the NHS Choices website, and how it would all fit together and not duplicate. One thing authorities will need to consider is that it's more than likely to cost, and that there will need to be funding found to commission such a service. The third area I'm looking at is market shaping. With this new legislation, the role of commissioning and contracting is really going to be changing. Instead of the traditional plan, buy, check model, commissioners will have a much more market development, market facilitation, market shaping role than the traditional purchasing function. Therefore, the bill introduced a duty to ensure that there is diversity in the types of support being provided. So commissioners will have to think about a diverse and plural market in their area. So local authorities, together with clinical commissioning groups, are required to assess and address the current and future health and social care needs of their population, and they do that through undertaking joint strategic needs assessments, and also they will develop strategies through their health and wellbeing boards. Local authorities will have a duty to monitor the match between the current supply of of care and support in their area together with the demand for such services, and they will need to report on whether there is adequate or sufficient services within their area. A mechanism for doing this will be through producing a market position statement, which should give providers information on the current supply, the demand over the coming years, and it should identify where there are any gaps in the market where provision is lacking, and that there needs to be some development. There needs to be really robust and good relationships developed between providers and commissioners to really shape the market going forward. The next area I would like to touch on is around the cooperation and integration agenda. There needs to be internal cooperation. There's a requirement in the bill for the first time that those responsible for adult care and support, housing, public health and children's services cooperating together. So no longer can there be handoffs between those different departments within the same authority. There is actually a requirement that they do work together, and that could create a real opportunity for making a difference to people's lives. The clause, though, does not require local authorities to take any specific steps to cooperate with external partners, but there are some other powers to promote joint working, and there is specific duties in relation to some individual cases, such as in the case of transition from children's to adult services, safeguarding, continuing health care, and when people move between one authority and another. But there seems to be a bit of a missed opportunity by not formalising that cooperation requirement. There is, in terms of integration, there is a general duty to focus on integration of care and support provision between local authority and health, where this would promote well-being of adults and carers, support prevention and improve the quality of care and get better outcomes. However, there isn't a requirement to do so. I'm aware that a number of some authorities have already integrated with their health colleagues, but this bill and legislation doesn't make it a requirement, so a potential opportunity lost on that front. An area that I'd like to just touch on briefly is the delegation of social work functions, and this is an interesting development. Local authorities may decide to delegate out the needs assessment work to a third party. So in terms of social workers doing their assessment role, that is something that could be outsourced, but it wouldn't cover the charging, safeguarding, or the actual making of direct payment. So it's only the assessment function that's eligible for delegation. By delegating, it doesn't absolve the local authority from its ultimate responsibility in ensuring that the assessment function is carried out properly. So there really does need to be good and robust commissioning and contracting skills in ensuring that any service specification and any model for outsourcing this function is actually scoped properly and well, and that once it has been done, that there are robust contract monitoring, performance and reviews taking place to ensure that the function is being carried out adequately. And the last section I'd like to focus on is independent advocacy support. The bill makes provision for local authorities to arrange independent advocates to exercise its function, and that is to represent and support an individual for the purpose of facilitating their involvement in assessment and planning, and also to represent and support an adult who is a case of safeguarding inquiry or review, and the advocacy would be to ensure that they're properly involved in such cases. So again, from a contracting and commissioning point of view, such advocacy support would need to be commissioned if that already isn't in place. So just to summarise what I have gone through today, from a commissioning and contracting perspective, local authorities will really need to consider the following factors. They will need to consider commissioning prevention services, advice and information services, and advocacy services. Local authorities really need to recognise the changing role of commissioning and contracting, that it is to become much more of a market development, market facilitation, market shaping role. There's the duty to cooperate better with internal colleagues, and there will be an opportunity to think how to structure that to get the best outcomes for individuals. There's to take into account integrating with health services and how that can improve the well-being of individuals and carers, and to get better outcomes. Consider whether outsourcing of the social work function is something that the authority would like to consider, and the implications of doing that. And lastly, local authorities will really need to think about the skills, competencies and training requirements of their current workforce in order to fulfil the new legal requirements that will be coming in April 2015. So thank you for listening. I hope you found that useful, and if you've got any questions, please do ask. Thank you very much.